Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Let's face it, when it comes to our health, infectious diseases can make us feel a little overwhelmed. But here's the good news. Knowledge is power. And today we're diving into treatments, medications, and the prevention strategies that are making a huge difference. Dr. Madeline Camejo, Chief Pharmacy Officer at Baptist Health, and Dr. Corey Frederick, Infectious Diseases Coordinator at Baptist Health, are here to give us the 411 and answer all your questions right now on this episode of Ask the Doc. Hi, everyone. I'm Olga Villaverde, and welcome to Ask the Doc, a show where we encourage you, the viewer, to send in your questions. And of course, we will get to those questions and answer them right here. So let's kick things off with Charles. He reached us through allhealthtv.com. Thank you, Charles. And this is what he writes. Dr. Camejo, I'm about to hit the big 50. Well, Charles, I passed that a long time ago. And I've been seeing and hearing a lot of ads lately for the pneumococcal vaccine. What disease does it prevent? And am I a candidate for it? Dr. Camejo?
That's a great question, Olga. You're absolutely right. And the question is very typical at the moment. Actually, the pneumococcal vaccine protects against a bacteria called Streptococcus pneumoniae. Now, which is a very nasty bug, and we'll call it strep pneumo for the short side of it. So it's the most common cause of pneumonia within our community. And additionally, strep pneumo can cause really serious sinus infections, ear infections, and all kinds of other serious diseases like meningitis. Now, while pneumococcal infections are very common in kids, older adults are the ones who are at risk for the severe disease and hospitalization. So receiving a pneumococcal vaccine is an excellent way to ensure that you don't catch a nasty bug of strep pneumo. So recently, there were very major updates on pneumococcal vaccines and recommendations, and the FDA approved and the CDC has recommended that a few new vaccines over the past few years. Furthermore, the CDC has recently lowered the recommendation age for pneumococcal vaccination. So what they call the PCV15, the PCV20, or the PCV21, those are the three different injections, are now recommended for all adults over the age of 50. So after you're turning 50, you're absolutely a candidate for pneumococcal vaccine, but make sure you talk to your doctor or your pharmacist about it for any further questions that you may have about it.
Thank you, Dr. Camejo. Let's move on now to Monique. She has a question for us, and she reached out through YouTube. Thank you, Monique. And this is the question. Dr. Camejo, I have diabetes, so unfortunately, anytime I get cuts, blisters, and skin ulcers, they're slow to heal and occasionally get infected. As such, I'd like to get your thoughts on topical antibiotics. Do they work as well as antibiotics we take orally, and can you use them simultaneously? Great question there, Dr. Camejo.
Yes. Hi, Monique, and I appreciate you reaching out. And this is an important question because you're right. Diabetics like yourself are more susceptible to infection. So one of the most important things you can do as a diabetic, practice good wound care and be mindful of any new cuts or injuries you might sustain. When you suffer from cuts or wounds, a lot of time there's a lot of bacteria in the environment, and it is a gateway to cause further infection. So when you are out there, make sure you clean, you dress the wound, you keep it clean. This is by far the most important thing you can do. And the best thing really is to improve your wound healing is one of the things you can do is make sure your glucose and your blood sugar levels are within golden range. Bacteria likes to feed on excessive sugar in your body. So if you monitor and be good at your goal, this can help promote your faster wound healing. Now, as far as topical antibiotics, they can work for minor cuts and scrapes. That usually has a slight risk of becoming infected, but they're not always needed for every new cut or scrape. So if your wound becomes infected with a bacteria, then definitely seek medical attention. Oral antibiotics are actually superior to topical antibiotics for bacterial skin infections. Furthermore, your doctor might be able to sample the wound to make sure you can send for a culture to see what is exactly to identify the bacteria that's causing the infection. And then he'll make sure he puts you on the right antibiotic to treat you properly.
Fantastic. Thank you so much. We've got another allhealthtv.com question, and this one comes from Andrew. We love this. Dr. Frederick, this one is for you. It's been a while since I've been able to buy eggs. Oh my gosh, I know, Andrew. Me too. Thank you, bird flu. But now that bird flu is in the news once again, it's got me thinking about vaccinations. So just how effective is the flu vaccine in preventing bird flu? Dr. Frederick, your thoughts, not to mention that eggs cost so much money at this point.
Olga, you couldn't be more right. Our current flu vaccine does not protect against bird flu, but let's talk about what exactly is bird flu. Bird flu is a type of avian influenza known mostly to cause infection in wild birds. Recently, this has led to exposure and outbreaks among a select group of people, mostly among dairy workers, as well as poultry and dairy cows. Among people exposed to bird flu, so far, most infections appear to be mild. Most are in cases of known exposure to infected animals. Symptoms people have described include mild fever, fatigue, cough, and headaches. But if you start feeling those things, don't worry. Those are also generally very common symptoms of the common cold. Luckily, right now, there are no reported human-to-human spread of bird flu at this time, and infection does seem to be relatively infrequent in the community. For more information, or if you have any reason to suspect you were possibly exposed to bird flu, contact your local county Department of Health.
All right, we got a YouTube question from Laura. Thank you so much, Laura. And this is what she's asking. Let's take a look. Doctors, our darling daughter, Danielle, just turned 7 years old yesterday, and I began to wonder if she's ready to get the HPV vaccine. Additionally, I'd like to know how it works exactly. Dr. Camejo, I think my girls were about 12. Is 7 a little too early? Your thoughts?
Olga, 7 years old may be a little too early, but maybe not by much. We'll discuss the right ages for children and adults that to be vaccinated against HPV. But for those in the audience that may be unfamiliar, HPV is the human papillomavirus, and it's a very common virus that causes warts on your hands, feet, face, and can spread from skin to skin contact. And additionally, it is also the most common sexually transmitted virus in the United States. Approximately 14 million people get HPV each year. And HPV is so common that it is the most sexually active people not vaccinated will become infected with HPV at some time in their lifetime. So most don't know they even have it. The major concern with HPV is that some strains can eventually lead to cancers like cervical or vulval or even vaginal cancers. Unfortunately, or fortunately, the HPV vaccine really has the ability to prevent more than 90% of those cancers that are caused by the HPV virus, which is really good news. In addition to reducing cancer risk, it also reduces the incidence of genital warts. But Dr. Fredericks, why don't you go over the recommendations on for ages of the vaccine?
Yes, absolutely. Currently, the HPV vaccine is recommended for patients 11 to 12 years of age, but it can be started in children as early as 9 years of age. Teens and young adults through age 26 that either did not receive or didn't finish the vaccine series, they can also receive vaccination as well. Now, something we often hear from patients or their parents is that they think the HPV vaccine really only matters for girls and that only girls can get HPV-related cancers. That's not true. It's protective for boys as well. Each year in this country, HPV causes approximately 36,000 cases of cancer in both men and women. Specifically, HPV is known to cause anal, oropharyngeal, and penile cancers in men. Additionally, vaccinating your child against HPV can help reduce the spread of these cancer-causing strains. Now, for adults ages 27 through 46 years of age, the vaccine has shown to be beneficial in this population as well, especially if they think that they are at risk. Specifically, we're talking about those who anticipate having future sexual partners throughout their lifetime. The HPV vaccine can help prevent against further contact and spread. So For people this age, it's recommended to talk to your healthcare provider about getting vaccinated if you feel at risk.
Great information there. Thank you to both of you. So we got another YouTube question. This one is from Perry, and this is what Perry is asking Dr. Camejo. My adult son has asthma, and during cold and flu season, I'm always worried about him getting another lung infection. What are the best medications to quickly treat lung infections in a person with asthma? Dr. Camejo, your thoughts here?
Well, here are some of the best medications for treatment. But whenever someone with asthma has a lung infection, the first step is to determine what kind of infection they might have. In this case, getting a proper diagnosis is key because based on your son's signs and symptoms, this will clue your doctor into knowing what treatment to prescribe. Now, for example, if we're in the midst of a terrible flu season, which we are right now, in the doctor's office, there is a rapid flu test that can be given with almost instantaneous results. So if your son was diagnosed with flu, he can receive a prescription for an antiviral called Tamiflu. So Tamiflu, which can also help actually reduce his symptoms and stop his flu from becoming very severe and have him feeling better soon. But there are no antibiotic or antiviral treatments for these kinds of viruses, so don't expect to get an antibiotic for them. But the best thing you can do for your son is to stay home, get rest, and remain hydrated. And additionally, make sure he gets an adequate supply of maintenance inhalers or any rescue meds that he might need to prevent so that he can handle any possible asthma attacks.
All right, another question for you, Dr. Camejo. So stand by. This is from Victoria on Facebook, and this is what she writes you. Good day, Dr. Camejo. My father came down with COVID-19 recently and isn't doing too well at this juncture. I'm so sorry to hear that. As a result, his physician wants to put him on corticosteroids to help reduce the inflammation. Doctor, I'd appreciate your thoughts on this. Let's help Victoria out, Dr. Camejo.
So that's a good question. Now, corticosteroids are a type of prescription that can help treat various types of inflammation people may experience. Now, sometimes these drugs are referred to or shortened name by steroids, which is very different from the term when we think about bodybuilders taking steroids. Now, corticosteroids are found naturally in our bodies, and prescriptions for these drugs can significantly give them those anti-inflammatory effects. Now, Victoria, I'm sad to hear about your dad with the COVID-19 diagnosis, but luckily he was able to see a healthcare professional and get treatment. And for COVID-19, we do have data that shows corticosteroids can greatly improve outcomes for patients with severe COVID-19. Wishing your dad all the best.
Absolutely. Okay, so let's stick to YouTube, and we've got a question from Miguel, and this is what Miguel is writing. Hola, Dr. Camejo. I got a really bad cold a while ago, and I went to my doctor to get some antibiotics, a Z-Pack. They wouldn't give them to me. The doc said my cold wouldn't get better with antibiotics, and it would only contribute to antibiotic resistance. Can you help me understand what that is? I think this question is huge, very important, because everybody seems to always want to resolve it with a Z-Pack.
That is true, Olga. But Miguel, I'm so glad you're asking the question about this, and it can be frustrating. But I'm going to let Dr. Fredericks, who is the expert on this, to easily answer your question.
Yes, I agree. This is an excellent question and a term everyone should become familiar with. Antimicrobial resistance is one of the greatest public health challenges we face worldwide. We have had the privilege of using antibiotics routinely in medical practice since the 1940s, since the initial discovery of penicillin. And since that time, antibiotics have made infections that were previously severe or possibly life-threatening much more manageable. But bacteria are intelligent and are programmed for survival. So as bacteria and fungi continue to exist, they can actually mutate and become resistant to the current effects of antibiotics and treatments. And as our antibiotic drug development pipeline begins to dry up, antimicrobial resistance is becoming an even greater threat because some of the illnesses that were once easily treatable may start running out of options to cure. One of the main ways we combat the threat of antimicrobial resistance is through the development of antimicrobial stewardship programs. Antimicrobial stewardship programs are local programs that healthcare systems have that help design interventions to promote appropriate antimicrobial use. Ultimately, antimicrobial resistance costs patients more money, takes longer for patients to start feeling better, and they're more likely to cause hospitalization for needed treatment. So what contributes greatly to antimicrobial resistance is the overuse of antibiotics, especially in cases when antibiotics are not needed, like a viral infection. Most respiratory infections like colds or bronchitis, those are caused by viruses found in the community. So not only is using antibiotics in this case not useful, it can be dangerous because it can help contribute to antimicrobial resistance. So you at home can play a huge role in slowing down antimicrobial resistance by having the knowledge that an antibiotic is not always needed every time you or a loved one are sick. Only take antibiotics when needed, and your doctor or pharmacist can help you identify which infections that they may be needed for.
And you just saw our website, allhealthtv.com. We've got a question from Maria. She went there as well. It's a great website. Check it out. Here's the question. Dr. C's and F, I've got another somewhat embarrassing question for you. I've noticed the unmistakable signs that I have a urinary tract infection. I know antibiotics work, but are there any medications or treatments that can prevent me from getting these annoying UTIs? So I'm going to be honest, Dr. Camejo and Dr. Frederick. When I was younger, I got so many of these, and the only thing that helped me was antibiotic, but I'd love to hear your response.
So, you first of all, Myra, you shouldn't be embarrassed about anything involving your body. That's really important to take care of it, so that's not a problem. Now, UTIs are extremely common, and they affect millions of people every year. So, in case of common uncomplicated UTI, bacteria is able to travel through the urethra and cause an infection in the bladder. So there are many reasons a person might develop a UTI, including improper hygiene, diabetes, certain kinds of birth controls, and sexual intercourse. Now, Myra, if you are thinking of experiencing any of these signs and symptoms of a UTI, your next stop should be an appointment with your doctor. But if you can't see them soon, I would suggest visiting a nearby clinic or even an urgent care for immediate treatment. You don't want to leave it to go on very long. But Dr. Fredericks, are there any other advice here that you could give Myra?
Yes, absolutely. Upon going to a clinic or an urgent care, one of the tests you will likely need to give will be a urine sample. And what they can do with the urine is test almost immediately for several things, including the presence of blood, white blood cells, bacteria, and sugar. So in case a urine sample does contain a small sample of bacteria, as long as you feel okay, it doesn't necessarily mean that you need to be treated with antibiotics. Urine is not sterile, and it's okay to have the presence of a few amount of bacteria in it at any given time. Antibiotics should only be prescribed if you have true signs and symptoms of a UTI, things like painful urination, frequent urination, and then pain just above the pubic bone. Those are just a few symptoms, to name a few. Now, Mara, if you are having frequent UTIs and you are looking for something to prevent them, that conversation becomes a little bit more specialized. It would be best to make an appointment with either your primary doctor or urologist to first discuss what might be the cause of these frequent UTIs. And for example, when do the UTIs occur for you? After what kinds of activity? What kind of bacteria are causing the UTIs? So based on this conversation and understanding the true root cause, your doctor can help determine a plan moving forward to having you feeling better.
Dr. Frederick, I'm not sure if this question is appropriate, but can somebody just have a predisposition for them?
Sometimes patients can have a predisposition for UTIs, and that could be dependent on a lot of different factors. So it's an excellent question. In that case, because there's such a myriad of different factors that can predispose those patients to UTI, they really need to follow up and have a more specialized conversation about what is that particular cause for the patient.
Fantastic. Thank you so much. All right. So let's go to Facebook. And this question is from Joshua. And Joshua writes, Dr. Frederick, I've been hearing an awful lot lately about the return of gonorrhea. Really? I thought that one was dead and buried. But since it may actually be still around, please let me know what are the most effective antibiotics for gonorrhea. Dr. Frederick?
Well, I think Joshua asks a very good question here. But unfortunately, gonorrhea is not dead and buried and is very much alive. Gonorrhea is a bacteria that is one of the most common causes of sexually transmitted infections. But it's also important to outline the difference between the term sexually transmitted disease and sexually transmitted infection. Using the word disease as an STD, that can give people more of a stigma. So for the past few years, healthcare practitioners have transitioned to using the word infection as an STI. Additionally, some patients that are exposed and test positive for gonorrhea may never notice any symptoms or changes at all. And this is why screening for STIs is so incredibly important to help treat and prevent the spread of STIs. Now, as far as which antibiotics are best to treat gonorrhea, commonly an antibiotic called ceftriaxone is used. Ceftriaxone is incredibly efficient in this case, as it can be given via a shot or an injection into the muscle as a one-time dose in the clinic. So no prescription, no having to pick up the drug at the pharmacy, and remember to taking multiple times a day. But remember, earlier in the discussion, we talked about the threat of antimicrobial resistance. Now, unfortunately, antimicrobial resistance is something to keep in mind, especially when we're talking about bacteria like gonorrhea. So in this case, after getting ceftriaxone, if your symptoms don't improve a few days after receiving, it's best to return to the doctor's office and discuss the next steps for an alternative antibiotic.
All right, we have a few more minutes left in our fabulous show, and let's see who our next question is from. Leslie. Leslie writes, Dr. Frederick, what is the role of doxycycline in treating sexually transmitted infections? Dr. Frederick, can you take that one for me?
Absolutely. Another great question. Thank you so much, Leslie. So very similar to the conversation we just had with gonorrhea, doxycycline is an antibiotic commonly used to treat chlamydia infections. Chlamydia is a sexually transmitted infection that can cause a couple of different symptoms. So notably a burning sensation upon urination, as well as some other symptoms as well. Those are the most notable. So Leslie, if you suspect that you may have been exposed, you should obviously seek medical attention immediately where they'll be able to test for the presence of chlamydia. Now, in that case, like mentioned before, doxycycline is often prescribed for 7 days, and it's important to take exactly as prescribed. Furthermore, there is some new evidence to suggest that doxycycline can even be used prophylactically. So in that case, it would be taken in people who are at high risk for developing STIs, but not necessarily treatment. This is still some new data, so it may need some further study before widespread adoption. But if you do have any questions about doxycycline and its role in chlamydia, please be sure to ask your doctor or pharmacist.
Thank you so much, Dr. Frederick. All right, we have a question now coming in from Grayson. Let's see what Grayson writes to Dr. Camejo. Dr. Camejo, can you please explain to me what RSV is? It's not bad enough that we have to worry about COVID, the flu, and the bird flu. Now we also have to stress about yet another infectious disease. And I kind of understand, Dr. Camejo, that we hear all of these and we get so perplexed and confused.
I know there's so many new vaccines out there that it does get a little confusing as when do you get what and what's the other. But the RSV vaccine, which stands for respiratory syncytial virus, is relatively new, but the disease RSV is not. Thankfully, we're hearing more and more about it because now we have the ability of having a vaccine for it. At this time, it's recommended to vaccinate all adults that are older than 75 years of age and any adults between 60 and 74 who are not in risk for a severe RSV. So who is at risk for a severe RSV? These are numerous risk factors, including chronic heart disease, if you have lung disease or diabetes, just to name a few. Ask your doctor or your pharmacist for more information about what specific risk disease factors you might have for an RSV that you might have. So RSV can cause mild cold-like symptoms in many patients, but in infants and in older adults, it can be really serious and also require hospitalization. And furthermore, by getting your vaccine, you can also help prevent the spread and protect those around you who may be vulnerable to RSV.
Fantastic. All right. We have, I think, time for one more question. So let's get this one in. It's from Izzy, and this is what she writes. Hey, docs, I just got a positive TB result. Does this mean I have tuberculosis? And if so, what can I take to get rid of it? And I must say, Dr. Camejo and Dr. Frederick, we only have about 45 seconds.
Go ahead,
Gotcha.
Dr. Frederick.
Hi, Izzy. This is a great question. A positive TB result can mean several different things depending on what kind of test you received. Positive TB skin test can indicate the presence of the bacteria that causes TB in your body, but it doesn't necessarily indicate whether you have an active or inactive disease. For some that have previously had TB and were treated, they can always test positive due to the presence of TB antibodies. Some people can be exposed to TB and have it in their bodies for years without being sick. These folks experience no symptoms at all and have an inactive disease. However, this still means they need treatment because without treatment, inactive TB can turn into active TB. If you have a positive TB test, you should talk to your doctor about making an appointment and with a specialist who will be able to properly interpret the test result and, if necessary, treat and monitor your TB.
Great information. Thank you both for joining us today on Ask the Doc. Truly appreciate your time and all the valuable feedback we got. And that's all the time we have today. I'm Olga Villaverdi. We'll see you next time on Ask the Doc.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.